Well, thanks for being part of this OneJax Vodcast. Our community conversations highlight leaders in our community who are doing good work, especially during this time of coronavirus, and as a way of knowing the good that continues to go on in our community and the people that do it.
And we are delighted to have with us today, joining Kyle Reese and me, Nancy Bronner from OneJax, Melanie Patz, who's the Vice President of Community Investment and Impact at Baptist Health, and Lynn Sherman, Director of Community Engagement for Social Responsibility at Baptist Health. And both are co-chairs of the Jacksonville Community Remembrance Project and leaders of 9/0 Forward. So Melanie and Lynn are quite a duo. And I'd like to also share that we're looking forward to honoring them as 2020 OneJax Humanitarians to recognize the work that they do and the contribution to our community. So congratulations again, Lynn and Melanie. We appreciate your work. And one of the things that that you provide that's so important to our community are programs on topics that are important in our society. And last night you had such an event, and that was a panel of doctors, medical doctors locally. And Lynn, tell us what that the focus of that panel was last night.
The focus of that panel was to have these experts come together as a panel to have a conversation with the African American community and anyone who cares about what has been happening here lately in this pandemic to African Americans, so that people can dispel some of the myths and the misconceptions, because within the African American community there has been a lot of conversation in groups, whether it be in their faith groups or just friends and family, and of course many of those things had come across to me because people were asking about what I believe about it. Is it true? And then some people were just holding on to it as if it was the gospel truth, and that some of these things were not. And so taking the time to have this panel of experts to really speak facts and to speak the truth and help people really understand at a level that they could understand was really valuable. And just simply because of the number of people who were interested in doing this and who registered for this panel was a clear understanding of how much and how badly that people are hungry for a deeper understanding within their community, not just what they get on the news, because what they get on the news is not enough. And when some of the things that they believed were that, for example, this was just a hoax, and it's not true, and it's something that white America made up for them and to scare or to give so that it can eliminate African Americans. And of course, more than one of the doctors addressed to that. More than one of them said, helped them to see that that was virtually impossible. But once that kind of belief start to roll, then it gets caught on to people who just don't know any better. And sometimes you might say, people should know better. I mean, you should really know better. That's not always the case because of how isolated some people are in terms of how they get their information and how they get their understanding. So there were several myths, and we selected those that were pretty well known and pretty prevalent in the community, that maybe testing at testing sites, for example, the swabs, we were swabbing people and giving them the virus with the swab. And we know that's not true, but if someone has that belief and they begin to have symptoms, then they're not going to do what they need to do to be healthy. They're not going to go be tested because of the fear that if I'm negative, I'm going to come out positive because they just gave me the virus. Mm-hmm. And I do know that people sometimes think, okay, Tuskegee, and they start thinking about the experience that was, known worldwide in terms of how African Americans were used as guinea pigs for that testing, so to speak, and so a lot of mistrust was embedded, and that wasn't Tuskegee was just one. There was just one opportunity where that happened, but there are others, and so people hang on to that, and they don't forget. They don't forget, and they believe that that somebody is out to get them. And so it was really important for us to try to bring the experts to dispel some of those beliefs that they had, and there were a few more that they had also.
And Melanie, you know, the national information, the national research about the disproportionate impact on minority communities has been in the news quite a bit. Can you talk about some of the factors? I mean, I know you talk in your work about social determinants of health and why particularly the African American community might have been disproportionately impacted by COVID.
So I will just repeat what our physician experts said last night. There are a number of reasons, and these have also been discussed in the national media. From an environmental perspective, we have African Americans who tend to live in more densely habituated places, and so they live closer together, and because this is a virus that is spread from person to person, that creates greater numbers of people with the virus. Another reason that was described last night by Dr. Gruber with Baptist Health was that we have a lot of African Americans who are in what we call essential positions. And so while other people were able to stay home, they were not. And so they're being exposed to the virus, and perhaps then going back to communities that are more densely populated and spreading it. And then from a mortality perspective, there's a lot of the people who have died from the disease have had other diseases like diabetes or heart problems or lung problems. And we know that African Americans disproportionately have those diseases as well. So the phrase that was repeated twice last night was, America catches a cold and African Americans get pneumonia. And I think this is yet another example of that.
Yeah.
I think as I reflect on the wonderful, difficult conversation last night, my main takeaway was that COVID-19 is just a magnifying glass of the health disparities that exist every day. I'm wondering, as you all reflect on last night, what was a major takeaway for the two of you that you're continuing to think about today?
For me, it is certainly that we need to do more, and we need to do more in terms of healthcare and education for people in minority or marginalized communities. I think we can't take things for granted, and I think so many times we do. And I left that conversation feeling as if there were many more people in our community who know now what they didn't know, and that to me was one of the biggest benefits, and it just encouraged me to want to do more. It encouraged me to use the knowledge and the position that I have, and hopefully the Jacksonville Nonprofit Hospital Partnership, to do more with helping our minority populations be healthier.
Mm-hmm.
I agree completely with Lynn. And I think the other big takeaway for me was having this virtually made it relatively easy for a lot of people to participate. And because we were able to record it, like we're doing this session right now, it's going to be able to live on beyond that one event. So I think one positive that we have all experienced is learning more about the technology that's available to us and how we can use that to accomplish just exactly what Lynn was talking about. We had almost 300 people attend the session last night, which indicates there's a lot of people who are hungry for information and hungry for dialogue as well. And so I think we've got a platform now that the Jacksonville Nonprofit Hospital Partnership can use moving forward.
Very good.
Let's talk a little bit about Baptist Health. So we are a few days into surgeries resuming, and I know that for the most part, you all have been away from the healthcare setting and the hospitals, but you are still intimately involved with all things Baptist. So what's happening? What's the feeling around the health system as whatever the new normal is going to be, we begin to walk toward that, hopefully?
I'll say the calls that I have participated in, there's been a spirit of excitement about getting back to serving our community. And we know, I mean, we were serving the community, of course, during COVID, and we were happy to do so. We made sure that our patients were safe and protected and our team members were safe and protected. And that continues to be top of mind for us. It's extremely important. And we're also concerned, frankly, for community members. We've heard stories of people having strokes and delaying going to the emergency room when they need care. And all of the physicians last night spoke to that as well, because we want to make sure that people are not delaying emergency care because they're afraid that they're going to catch COVID. All of the hospitals in Jacksonville, including Baptist Health, are safe. You can go and get care. And so we want to make sure that our community is healthy and that whatever diseases or injuries that come across, that we're here. We want you to know that we're here and we're able to take care of you in a safe way.
Very good.
Yeah, and also, as Baptist is doing all this wonderful work on its campus, we're also reaching out into the community and providing ways to help life be easier and manageable for some of our senior citizens, working with nonprofit organizations to ensure that seniors can get the food that they need and they can get the toiletries that they need as they have to isolate themselves because of their age. They're in a high-risk category. And so the work did not stop with the departments within Baptist, the Age Well Center, as well as the team of social workers and social responsibility. We were able to, work together as a team. The social workers were amazing in terms of developing plans for how they would assist patients who were discharged from the hospital with whatever they needed when they left the hospital. So not just on campus, within the hospital, I think Baptist is continuing to spread its wings, but also within our community and with our nonprofit organizations. And, there is a really big high-risk group who is very valuable to Baptist, and that is our auxiliary groups. And our auxiliary groups are now beginning to get involved with a way that they can help other seniors in the community who are isolated. And so we're working with a friendly caller program, and they would call people just to check on them and see how they're doing, and to find out if they're okay, and just to develop a friendship with them over time. And that we know that isolation for seniors can certainly create a lot of health disparities, and just having someone to talk to and to care, someone who cares about the fact that you are alone, is really huge.
Mm-hmm. Very good. Let's talk a bit about the Community Remembrance Project. And of course, with everything disrupted by the pandemic, we're not allowed to, get together in person. But has the work continued, or where are we on that project? Because it's so important for our community. Melanie?
Yeah, yes, the work continues. In fact, we had a meeting just Tuesday night, again, using Zoom. We all got together and talked about what our next steps are. And we're even thinking about doing some virtual events. And so we had a call just this morning with our historians and the researchers at the Equal Justice Initiative to talk through some of the background, the history, the records, and the archives of the people who were racially terror lynched in Jacksonville as we plan for future events. So we continue to move the work forward. We're also, we've had a little bit of a pause because of COVID on the historical marker, but we have had a meeting with the city of Jacksonville, and we're finalizing the language for the historical marker that will commemorate the lynching of Bowman Cook and John Marine. That's at Evergreen Cemetery. And so we're making progress and moving forward on that. That event would probably happen later this year. It is accompanied by an essay scholarship competition. And so we want to make sure that students are aware and available to be able to participate in that as well.
Very good.
I'm wondering,
Go
what
ahead.
was the moment, oh, sorry, Nancy. What was the moment, obviously the Remembrance Project is a part of the Equal Justice Initiative. What was the moment, or what was the process that led you to say, okay, this is something that we're going to take on in the city of Jacksonville?
Lynn, you want to share about that?
Well, actually, it started with the 90 Forward group here in Jacksonville. 90 Forward, of course, you know, is just a group of people in our community who came together initially to have conversations about race about 5 years ago. And that was one of the projects that 90 Forward took on, and took on because of a connection actually that Melanie had with Kiara Boone, who was here in Jacksonville working with the Jessie Ball DuPont Fund, and she was a fellow with them. And so I think she shared that project, the EJI project, with Melanie, and Melanie brought it to the 90 Forward committee or board. And we decided that it would be something that this group can take on and implement here in Jacksonville to just bring to the attention of our community what lynching is and who was lynched in our area, and how lynching impacts not only our past, but it also impacts our future and how we navigate through our lives currently. So that's how it got started.
Well, it's an important piece of our history that many people, I'd say probably most people, really are just not aware of. So we appreciate that you all took this difficult topic on, and are helping our community and our country really recognize this piece of our history, no matter how dark it is. So we so appreciate you being with us today and sharing your work, sharing your perspectives, and continuing to help our community be a healthy and respectful place. So thanks to both of you, and we hope to see you again on the other side of this crisis in person next time. So thank you.
Thank you.
Thank you both.